you really want to get better at what you're doing, you have to be able to measure it. So that's the basis of the outcomes strategy. It allows you to measure your performance in regards to how well you're treating your patients.
So when a patient walks into the door, they're set up on a kiosk by our administrative staff, and they're taken through near a 5 to 10 minute assessment process that asks them questions about their medical history, specific questions about their clinical behavior, and then standardized assessment questions that are going to give us their benchmark levels of pain, function, and levels of daily activities. We're looking at their level of improvement throughout the whole care process, so from beginning to end. So we use that information to look at on an aggregate level how good an individual clinician is doing, to see if we need to provide extra education for that clinician, how good a specific clinic is doing, to see if there's a clinical problem that's persistent throughout the whole clinic, or how good a clinical program is doing. For example, for a certain self-insured employer client, or for a certain health system, how good the musculoskeletal care is from a clinical outcomes perspective. So we're analyzing all that data using our analytical software, and then reporting on that on a regular basis to the client.
If you're not looking at how you're doing as far as your outcomes with your patients, or if your patients are improving and you're never checking that, then you never know if you can improve or if you need to improve.
So data analytics, that's a broad term. It includes many things, but for us it means taking measures such as claims data and looking at patterns in that data and analyzing models, extracting models from the patterns that are in that data. So we take our clients' claims data, which are often 1 or 2 million records for a year for a larger client, or maybe if it's a smaller client, it's 2 or 3 years worth of data that aggregate up to, say, 1 or 2 million records. And then we take that data, the claims data, we process it, clean it up so that we can understand it. And then again, we look for those patterns in the data. Those patterns allow us to build models and so set thresholds where we define an opportunity where our clinical methodologies can come into play and help reduce the cost associated with all the treatments.